Thank you, Musawwar, for your kind sessions. If anyone of you have question, you can ask from any speaker.
Yeah, I have a question. Musavar, it was a very great initiative. First of all, allow me to admire the step of the YDF for the community awareness of Mpox. So, Dr. Rina, it was a wonderful presentation as well. So, some internet disruptions as well that deprived us of the valuable thoughts of Dr. Rubina. But I have a question from you, Dr. Rina, that I want to get into some intricacies of Mpox. It was a very valuable session, but I want to know more about the deadliness of the disease of the Mpox and the clade 1 and clade 2. I have heard that clade 2 is more prevalent in Pakistan. As you are a health worker, so I think you should guide me about this.
I think his question was directed to Dr. Alina, but as your voice was very low, if you can speak a bit loud, or maybe you can write down your question so that we can have idea what you really want to ask.
Ji, Musavar. Now I am audible.
Yeah. Now it's fine.
Okay. So my question is from Dr. Alina. Dr. Alina, I want to know about the two distinctive clades of Mpox, that is clade 1 and clade 2. So clade 2 is mostly prevalent in Pakistan. So what do you think about the deadliness and fatality rate? I think there are two or three cases till now in Pakistan, but can it cause more fatality or can it be the new COVID? Can Mpox be the new COVID in Pakistan?
Can you please write it down?
Okay.
I just heard clear too that sorry.
I think he wanted to ask about the main question that monkeypox can it can be like COVID-19, or I mean, how do you see this? Like because there are very less cases of monkeypox. So his question was like, how do you see this? Like it will be like a COVID, or because it only spreads through animals and all that. So this is what I think he wanted to ask.
So basically, what happens at there is this two traits, obviously clade 1 and clade 2. Clade 2 is primarily it is found in West African countries such as Nigeria and Liberia, and they both are capable of causing human disease. But the 2 1 it is most human to human transmission is something related to adult men, and this the one which spreads through basically through bodily fluids and sexual contact. So I don't think so it will be uh, related to the same as COVID. That COVID spreads through respiratory droplets, right? So that is infection rate is more high in COVID, and patients infected with clade 2 they experience less and fewer complications, but it also has a lower mortality rate as compared to clade 1, although it gained significant attention during the 22 global outbreak. And but I don't think so it is it is related to it is equal.
Okay, ma'am. Thank you. And what's about the mortality rate of Mpox currently?
I just discussed it. Okay, about 0.1%. I have just written it down in my presentation. About 0.1% to 10% mortality. Till now, there's 207 deaths just because of the complications, and people who are immunocompromised, they may get it through secondary infections like respiratory infections they can get. So according to available data, 0.1% to 10% of people with Mpox have died just because of complications, because mostly it resolves by its own.
Okay, so Dr. Reena, thank you so much.
Sorry?
Thank you, ma'am.
Okay,
Yes,
if
it was.
anyone else has questions, so please you can ask.
Assalamu alaikum. My name is Arzu Nasir. First of all, I would like to praise you, Dr. Alina, the way you explained the monkeypox. Thank you so much for that. My question is after getting presentation from you, I understood that monkeypox is more affecting the younger ones or the adult ones. So my question is, can the children too?
Can, and in children it can be more severe because of them, so they can acquire those infections from their family as well, from anyone else, so they have very low they are very immunocompromised, and they can lead.
I think that I had listened that people who are more related to health issues can be more prone to mpox. So I want to delve more deep that how the agriculture related people are more exposed to mpox.
I think that that question should not be directed to me, because that can be asked from a health official, or maybe Dr. Alina is here. But as she said in her speech as well, that that this monkeypox can be, those people which are impacted by monkeypox close contact with animals. So I think that is why I said that they are the ones who can be impacted. So because of her statement, or whatever she said. So maybe she can explain in a better way about it.
Yes, okay, maybe it didn't indicated from the presentation of Dr. Alina that it was related to some specific animals. She said that it was related to some specific animals. So, Dr. Alina, can you elaborate more how we are exposed, how agriculture people are more exposed to mpox?
Okay, so basically what happens that agricultural workers, they are in close contact with animal reservoir of the virus, such as rodents. Rodents include squirrels and rats and non-human primates, right? So these animals, they are common in rural and forested areas where agricultural activities are prevalent. That's how they, agricultural activities like hunting, farming, or livestock, they're just handling these things daily basis, right? And the rural people, they have very limited access to healthcare settings, so these cases remain unreported and undiagnosed. That's why the rate of transmission is increased within these communities.
Ma'am, according to my,
Because I have said that this is a zoonotic disease, na?
what
That's
do you
why.
mean by a zoonotic disease?
Basically, zoonotic disease means any viral disease which spreads between animals and humans and animals.
So,
It is
as
caused
for
by a pathogen.
as, as far as from your presentation, I had known that it can be I think it can be more prone from direct contact, the sexual contact, close contact. So how this close contact is applicable to agriculture animals?
Yeah, what happens that the animals, they bite you through biting, through scratching. That's how.
ठीक है मैम, thank you so much मैम.
Hunting as well, hunting.
I have a question.
Yes.
When you like have a contact with someone who has monkeypox or anything, the symptoms don't appear immediately, right? It takes 6 to 13 days, right? So before the symptoms appear, can you infect someone
Before the symptom appears?
Can you like infect someone else or spread the monkeypox?
Yes, because you know what happens in incubation period, that is known as incubation period. Before you develop symptoms, till the onset of the symptoms, the time between you are exposed to that virus and the onset of symptoms, that is an incubation period, and that is really dangerous. You can spread infection at a very high rate because you don't know, na. You don't know. You are being exposed to so many people
Okay, thank you.
because you're not showing basically the symptoms, and yeah, that's why.
Okay.
Do we have any other questions? If you can turn on your mic and you can speak, or maybe you can write in a chat box as well. If anybody wants to, ask any question, you can simply write down in the chat box as well.
Ma'am, one last question from Dr. Alina. You have talked about the vaccination for Mpox, like there is no direct vaccination for Mpox, but I want to know the status of research about the direct vaccination of Mpox, like what new research has been done in this scenario.
What new
Yes,
research?
ma'am. What new research is aimed at direct vaccination for Mpox,
Yeah,
only
because
aimed at curing
see,
Mpox.
certain vaccinations like modified vaccines and Cara. These are some names of vaccinations which were used for smallpox, right? So now they are modifying those vaccinations only to use for the Mpox virus to increase its effectiveness. They are just increasing their effectiveness, and they're choosing the ones which are will having less side effects. Like there are some, this as I've told you, there's this name like ACAM 2000 vaccine. So these are being used but not mass vaccination. Like they're not having mass vaccination right now. Only those who are susceptible and who are at high risk, that is recommended for them. That's why we are hardly heard of those vaccinations.
Yes, ma'am, I got your point about the targeted vaccination, but I am inquiring about the direct vaccine that is a cure of Mpox. Is there any research related to
These
that?
are the direct vaccines only. These are the direct
Okay,
vaccines only.
okay, ma'am.
I think, yeah.
I meant to say that these are the vaccines, but they are given with more effectiveness and less side effects as was given for smallpox. The vaccines are the same.
Okay, ma'am, learned a lot from you. Thank you for your perspective.
Dr. Alina, we have one more question that's in the chat box. What are the long-term health effects of monkeypox? Like, what are the long-term impact of monkeypox? Like, this is the question from Mehek.
What are the?
Yeah, what are the long-term health effects of monkeypox?
Okay, so basically what happens that you got some rashes, right? So after the lesions heal, say some individual, basically it not happen to everyone, it doesn't happen with everyone. So just letting you know about that. After the lesions heal, some individuals may experience changes in skin pigmentation, right? Dark spots, and some eye, the virus can also affect the eyes, right? So it may affect your cornea, and in severe cases, if we talk about the complications, it may lead to blindness as well, because the virus, it affects your vision as well. So secondary infections could be, the pneumonia, breathing difficulties, neurological problems because of the headaches. It can cause infection in your brains as well. So that varies with very less individuals. Otherwise, that is just, when you get affected by a viral infection, you get your immunity. You don't have the immunity, right? So the person gets recurrent infections again and again in some people. So they can be affected like that. Your mental health can also be affected, which is the basic thing. And some joint problems can also be affected in the later ages as well. So these are some problems.
There is also one more question that is, I think, written that because of the monkeypox, which organ can be affected? Like, is it maybe lungs, or any other any specific organ that can be impacted by the monkeypox? This is the question. This is from She's Bugio.
See, what happens that Mpox, it is a viral infection. Obviously, it can affect your different organs like skin, your lymph nodes, your respiratory system, your eyes, your gastrointestinal, digestive system, your nervous system. So it varies from person to person. Not a specific organ is indicated. If we talk about long-term effects, right? All individuals get long-term effects. They resolve by themselves. Is it clear?
Okay, thank you, Alina. Is there anyone who have question you can ask so that we can end the meeting? I think no one have any question. We can end this meeting now.
Yeah,
Thank you so much,
yeah.
everyone, for joining this meeting.
I have some question.
Yeah, you can speak.
Yeah, so thank you very much for this opportunity. I think I joined late, but then I have this question in mind that I don't know whether if you have already answered that. But is there a specific group of people who are vulnerable to this monkeypox?
Clear?
I'm saying that is there any specific group of people within our society or in the community who are, vulnerable to this monkeypox?
Yeah, basically, first of all, me, healthcare workers, we who care for patient with Mpox, they are at a high risk of exposure. And secondly, people living in endemic areas like Central and West Africa, especially the countries like Nigeria, uh, DMC, Democratic Republic of the Congo, and zoonotic areas, individuals who are in close contact with infected person, household contacts, sexual partners, in immunocompromised individuals, people who have HIV, have sex with men, and people who handle wild animals. These are basically Is it clear?
I think we don't have any further question. So moving towards Aisha. Aisha, if you can hear me, we have
Yes, yes.
to end up. Yeah. So you can just give your answer to the question.
Questions.
Okay, thank you, Alina. I think now we should end this session. Thank you everyone for joining and giving your precious time. And thank you so much, Alina, for your precious time. It was
You're welcome. Thank you so much for having me. It was great.
it was great. Okay, I think we should end this now. And although this virus is very dangerous and life-taking, but in Pakistan there are very few cases, or the number of cases is very less. But we should have that precautionary measures, and we should avoid and we should take important unhygienic people are, I think, more like in contact with these things, and they can, like, their immune system can be much weaker, and it can affect others also. So I think it is very important to have precautionary measures, and we should avoid these things and this contact in that time when it is spreading. So about this, it was very